and welcome to the program. For years, Ukraine's outdated healthcare system was in dire need of a complete overhaul. Both the emergency and primary care systems did not provide the adequate attention to those in need of medical care. In fact, one recent survey suggested the majority of Ukrainians believe that a health emergency will leave them penniless. But a lot is about to change. After much political wrangling, the Ukrainian parliament voted in favor of a package of healthcare reform laws. Joining us in the studio to discuss what the new law means for Ukraine is Andriy Guk. He is the representative of the Ukrainian Association for Health Promotion. Welcome to the studio.
Thank you.
So, first of all, after the first package of these laws have been passed, what does this mean for ordinary Ukrainians?
It means that our patients, Ukrainian patients, will receive a healthcare service, basic package that will be designated by government and will be covered by government. The second part of guarantee package, it's some health service that should be co-paid. And the third one is completely very openly stated that it will be not never covered, like aesthetic surgery, plastic surgery, like that.
No, what does the term co-paid mean?
Co-payment, it's that patient have to make some donations, or not co-payment, I mean additional payment to the what government covered. I mean, if you're talking about the maybe better service, if you're talking about some long-term inpatient care that cannot be fully covered by government. So again, this is why so huge discussion in Parliament, because have to divide these three packages in a proper way, and do not give patient any extra obligations or promote something that government will be not able to cover.
Right. So just to make it clear, the patient will be paying a certain sum, for example, each month as a type of insurance to their own healthcare budget, or for their own care for the future, or how will this work? How do you see this working?
Yeah, good question, because our system will be paid through our taxes as it is now. It's no additional payment, Only if you're talking about the voluntary insurance scheme and patient would like to have a better service, it is not obligatory. So next step, it is again under discussion, will be the obligatory health insurance with additional payments. Because so far we have a very slow economical growth in Ukraine, and salary unfortunately not give us a chance to make more payments for healthcare service. The first option is to utilize our resources in better way, to provide more effective service to patient.
Right.
Not only pay again for empty beds, for maternity house with only 100 births per year, because it is recommended that it should be at least 300 per year to be with good quality.
Right. So you see the government, the healthcare system taking care of each Ukrainian individually, a program that will provide for pensioners, for people that don't have a high salary. You want. There's been a lot of talk that this new healthcare reform will replicate the Canadian and the UK healthcare system.
Yeah, that's correct. But a lot of problems that Ukraine earned for the last 25 years is completely different from UK or from Canada. That's why we cannot replicate these systems from different countries. We have to find out the ways how, starting from primary health care, we are talking now about three clear options for every patient. It's primary health care, it's emergency care, and palliative care. All other services still under discussion because government don't have enough budget to cover everything free of charge, as it is stated in our constitution. You know, we still have constitution that promote or declare it that all kind of services in state and municipal healthcare facilities should be provided free of charge. It's completely not true. It's impossible to do. That's why we have a lot of people that really know that there are lack of medicines, lack of supplies, and they have to pay for every supply and for every medicine. But in case of lack of money, they cannot do that. That's a problem.
But so, according to the new health reform, there will be also a pay increase for medical professionals, for doctors, for nurses. How do you see this affecting the overall healthcare budget?
Good question. We are talking about very low income now for doctors and healthcare workers, and one of possibility will be to work more effective in public hospitals, but at the same time, every physician, for instance, for primary health care, will be able to move to private practice and to have a better coverage and better income. The same for inpatient sphere, inpatient facilities, because people who are working also will be able and will have some incentives to work outside of state hospitals in private sector. And people also take it in account the willingness to pay, because people would like, okay, to pay some money for better service. But unfortunately, in state healthcare facilities, they're not able to get this.
They're not able to afford this. Yeah, they're not able to afford this. But so how do you envision the cabinet of ministers, because this new health service would be an independent body of a branch of the cabinet of ministers. So if there's very little money now there, how will this new healthcare bill be actually financed? Where will the money come from?
That's again a lot of debates about that in the parliament, because we have to find out money to finance at the level that will give the possibility to follow best practice. That's a main big question. That's the main battle now, and that's why the second law not passed through parliament, because there are disbalance. It's not balanced between decentralization and central body under the cabinet of ministers. There are a lot of discussion among different fractions in the parliament, but I hope that within the next weeks it will be discussed, and some decision have to be found. Have to be found, because in case of failed of healthcare laws, we will lost again 1 year, and next one can start only next year. But it is absolutely not appropriate for Ukraine, because we are losing almost 150,000 people every year for different diseases, but majority is stroke and heart attack. And in that case, it's absolutely that can be managed through the new system.
And you think this new healthcare system will help decrease that number from 150,000, like you just said, to
at least in case of we are saving 50,000 or 60,000, it's a big success.
So half of that number, you think it's because of the lack of medical treatment that they received? They didn't receive the proper medical treatment that they required. Half of those people died because of that.
It is because of lack of a clear pathway for patient. Because after healthcare reform, we will have a clear pathway for every patient, from the if we're talking about, for instance, emergency care, so from ambulance, from the street to the facility, with well equipped with medicines and with supplies. That's the target of the reform.
That seems like a good target. Now, one of the other issues has been healthcare, a working healthcare system for Ukrainian war veterans who have received life-altering injuries, who need prosthetics perhaps, who don't have the financial means to purchase these prosthetics as well as other medical equipment to continue on with their lives after they fought and they've sacrificed their lives. Now, is there a clear plan, or is there some kind of roadmap for Ukrainian soldiers who need a working healthcare system?
First of all, there are no real roadmap at the moment, but law that will really clarify flows, financial flows for different kind of healthcare can be really helpful, because we will see the places where our veterans can receive good quality. Because unfortunately, so far, probably you know, we don't have enough rehabilitation centers in Ukraine. That's the main problem, but also we don't have, not only for our veterans, we don't have for our patients after stroke. That's true. That's why, in other words, money will not follow only facility because it's only working or without patients. Money will follow to that facility that will full of patients, and that will be more effective for us.
And you see that being as a more effective model for Ukrainians. And we'll have to see how the parliament decides to alter these bills to fit Ukrainian society as needed. Thank you so much for joining me today in the studio.
Okay, thank you very much.
We have been joined by Andriy Guk. He is the representative of the Ukrainian Association for Health Promotion. We've been discussing the latest changes to Ukraine's healthcare system. You're watching UATV.